you've seen my message?
Yes.
Hello, good morning, happy Sunday. For those of you who go to church on Sunday, we are tuning in. I'm tuning in from New Jersey. Mary is tuned in from Kenya. Sam is tuned in from somewhere
From Texas.
Texas. We welcome you to our first live broadcast for mental health awareness in Gusii. We are a few minutes late. I'm going to apologize. This is our first time trying to get together. So 10 minutes past the time, but we are asking you guys to forgive us. So we are going to go right on the broadcast. I just want to go to my Facebook page to share Sam real quick as you greet people while I share this link for people to join us. Go ahead, Sam.
All right. So my name is Samuel Guaya. As Penny said, I'm in Texas. I practice psychiatry. I'm a nurse practitioner. And with us here today is Mary Gitau. Mary is a good friend of mine. She is a specialist in mental health. She specifically has studied suicidology. She has a master's in that. She also has another master's in, I believe, in psychology. She is, you probably have seen her name somewhere. She was one of the finalists in the under 40 2023 for her work in Kenya. Mary and I have worked together in an NGO called CSRI, where we work specifically to prevent suicide and for those who are victims of suicide to render some kind of support. Not necessarily the victims, but those who are affected by it, because the victims are gone if they actually have a successful suicide. Mary will also be able to say a little more about herself. But I'm very excited to have her on board. She is going to be an asset to us in GMA. Welcome, Mary.
Hi, everyone. Good morning. Thank you, Sam and Penny, for having me here this morning. And for everyone else, thank you for joining in, and happy Sunday. Of course, for us, it's evening here in Nairobi. I'm so delighted to be part of this conversation today, and just to talk about what's happening to us when we talk about suicide and the larger mental health, and how we've been affected in different ways, because maybe most of us, if not all of us who are here, have been affected in one or another by suicide. Either we've lost someone we know, someone in the family, or either we attempted suicide, or who has thought about suicide. So that's what we want to discuss today. I am based in Nairobi. I am passionate about saving people's lives, and especially people who struggle with suicide, because we can prevent it. We can prevent it. We can do something to, to make sure that, or to try and help us live longer and deal with the pain that we feel that cause or lead us to suicide.
Thank you, Mary. So Amber.
Thank you, Sam.
Thank you, Sam. So for those ones who are finding me for the first time, my name is Penny. I live in New Jersey. I am the founder of amasase.org. It's a non-profit organization where we focus on giving girls sanitary towels, trying to get communities around the world to come together and educate or help children go to school. We also have two groups that are global, that brought the Gusii community together. We are like around the world where you're connected. Personally, I'm very much passionate about mental illness. I have spent the past maybe 25 years working with people with developmental disabilities for the state of New Jersey. I'm not a doctor, I don't have doctorate, but I'm just a trained counselor where we help people who are born with developmental disabilities plan their life and we do community inclusion, and we speak on their behalf. And I have to say, there's a friend of mine that is in Dubai. After the case of this young man that killed his 2 children went around on social media, her name is Tabi. Tabi reached out to me. I think that was really, if I have to say, a breaking point for me to be like, you know what? All of us are doing something. All of us, there are so many people like the 2 of you are giving back to the community. I thought it would be nice for all of us because everybody is giving in a small way. And I thought if we all came together maybe once or twice a year in our own capacity to try and create mental illness awareness, because after I watched the video, as soon as I finished watching the video, Tabi called me, and the parents of that child, of the son, were well aware that the son was sick, and they had tried to seek treatment, but they really did not help the child. And the reason why we wanted to create awareness in Gusii, mental illness is something that has never been spoken about. It's something we don't even talk about. It's something we don't discuss. When things happen in Gusii, we always blame the witches, or we blame somebody, we ban people. So I don't think, like any other disease where you are diabetic, where you have high blood pressure, and Mary, you're going to cover that, I'm sure. The problem with mental illness, there is no proper diagnosis. You are not able to take someone for blood work and then they say, yes, Mary, you're sick, or some, yes. And then there is the stigma thing where people are talking about, they're mental, they have bipolar, they're depressed, and then there's the treatment. What are you treating, Mary? I'm sure you're going to cover that. That's why we need the professionals to come together and tell us what is mental illness. What kind of help is available out there? What is the history? This child already killed these children. Maybe this disease has been in the family and nobody caught it. And then we talk about the environment. The reason why we want to go to Gusii, and now we are tapping to everyone. We are not just saying Gusii, come. No, we are saying everyone who has any knowledge about this disease, please come educate us. If you are Kikuyu and you cannot speak Gusii, you're going to speak to us and then we translate it. So we go to the environment where these things are happening. Because of the smartphones, we hear stories happening from Gusii every time, even on social media. They're like, something is going on in Gusii, and it's a story. It dies out, then another case comes out. So my vision, what I'm looking at, is all of us professionals, at large, and any of us who has someone who has knowledge, who is non-Gusii, is welcome to help us, so we can go to the local areas and educate our people that mental illness is a disease just like any other disease. And Mary is going to help us to walk us through what it is, the causes, the treatment. And I think as soon as we created the group, all of you who are in the group, you noticed the biggest need that is there is the support group or the treatment. People need help. And Mary, you're on the ground, you know that people need help. So we are looking forward. If we look a few months ahead, we want to be able to create a support group that is able to feed the needs of different people. Some people have insurance, some people have money to pay. Everybody's case is different, and we are hoping that as a team around the world, we can try to even raise money to fund some of these people who are not able to get treatment. With that said, I am going to drop it there and let Sam take over. I will only interject as needed, but Sam, again, the mic is yours. Thank you so much for tuning in. And if you have any questions, you can put them on the chat. We are able to see them, Mary and Sam, and then they will respond to you at the end of the program. Thank you.
Thank you so much, Penny. Today we are talking about suicide. And I believe most of you know that suicide is when you intentionally attempt to or take away your own life. Uh, Previously in GMA forum, I know I saw a discussion that I wanted to interject in so bad, but I was waiting for the right forum where we were talking about why do we criminalize things like suicide, mental illness. And today here in this forum, I want to tell you that, especially here in Texas where I practice, we have an ethical and a legal responsibility to prevent our patients from harm. Sometimes that means preventing you from yourself. The thoughts that you want to hurt yourself, I have to take care of those. That's why in every assessment I do, there are two things I have to check. I have to check if you have suicidal ideations, and I also have to check if you have homicidal ideations. I don't know if that is the standard in Kenya, but it is the standard here. And I have to check that with you, and then I have to document that. So today here, we are going to discuss and see how we can prevent suicide. I know you know someone or you've heard of someone who has committed suicide. Recently, there was a teacher in Gusii who left a suicidal note and then he just killed himself. People owed him a lot of money and he was not able to bear the pain. So this is why it's relevant to us. That's not the only case. I also have someone within my village who decided to kill himself because he didn't have enough fees to support his girl who was joining Form 1. So he saw that the easiest thing to do is suicide. Those of you who are listening to me, please share this to everybody you know. Suicide is not a solution because the people who are depending on you, when you go ahead and commit suicide, what you have actually done is give them more pain. You give them more pain because the solution to what was happening is not you getting out of the picture, but now they have to deal with that along with what they were dealing with before. So it's important for us to share these things and see how we can prevent suicide. I know Mary just fell off. She will be back. Uh, Here is something else I want to share as we start this discussion. When you see someone committing suicide, most of the time, they didn't just think about it right then and commit suicide. This person um, has planned on this. And what I find from practice, and we'll talk about this a little more, is that usually suicide is something they're doing as a response to what is going on in their lives before. Some people go through a life changing event that is so serious for them that they end up deciding, now I want to commit suicide. A good example is divorce. Some people go through divorce and they are not able to bear the pain. Another example is abuse. It can be sexual abuse, it can be physical abuse, it can be psychological or emotional abuse. Some people go through that and then they decide this is it. So when I am doing my assessment and someone tells me I want to end it all, or someone tells me I cannot bear the pain, I usually have to dig deeper and see what they mean and see if they have suicidal ideations so that we can prevent those. Some of these people, they have undergone what is called depression. So they have had depression for a while and they reach a point where they say, this is too much, I cannot bear it. What I don't want us to do then is to diagnose ourselves. I wanna sound that warning to all of us. Make sure you go to a qualified person because we have a standard that we follow. We don't just diagnose you. We have to follow a certain standard so that we don't just treat you for the sake of it, but we treat if there's a need for us to treat. For example, I will tell you, we are really when your symptoms began. We are really interested to know what time of the day do you experience this? How long has this been going on? And does it come every day? So that way we can be able to give you the medication that is specific for you so that it can help you. One other thing I want to say before I give Mary a chance is that most of the people have reached a point where their self-esteem is so low. They just feel that they don't matter. So if you live with someone and they reach a point and they start telling you, I feel useless, I feel like I don't matter, I feel like you all can do without me, that right there is a warning sign. So I want to give Mary a chance. And Mary, why do you think the suicide or the homicide cases are so rampant in our region, in Kenya, and more so in Gusii, if you may?
Thank you so much. Thank you so much, Sam and Penny, for this opportunity. So, okay, of course, now I think in the news it's been there so much in the Gusii land, but that doesn't mean that it's only happening in the Gusii land. I think it's become something here in Kenya. So this is what I want to say about suicide. One, those people who are struggling with suicide want something to stop. And this thing is not the heartbeat. It is the pain that they feel. And the founders of suicidology actually said it's an extreme mental pain, to a point that it's called psychic. It's an extreme mental pain. It's very painful. So somebody who is in that state is feeling so much pain mentally, they want something to stop, but that thing is definitely not the heartbeat. And so that's why when you're working with people who are struggling with suicide, we ask them, what is leading you to this? What is making you want to end it all? So that we can be able to deal with the root cause. That's how we do the diagnosis, because we want to address those things that are actually causing them to lead to suicide. And personally, when I'm working with clients who are struggling with suicide, when I'm seeing them, I'll ask them, where does it hurt? And they will describe. They will say, I have lost my job, I've lost a relationship, my relationship is not working. And then I'll pose the question, how do you want me to help you? I do not want to assume that I know that what kind of help they need. I want them to tell, how do you want me to help you? And most of them will go, well, I wish I can be able to recover my family. I wish I can be able to get a job. I wish I can be able to stabilize in a way. If all that is in place, then I think my life would be better. Then I think I would not choose to end it this way. Unfortunately, suicide again is a systemic issue. So the system, it's not personal. It's the person who is making that decision to die of suicide has so many other things that are contributing to them attempting suicide. And that's the same thing to homicidality. It's a systemic issue. What's happening in our system? Lately here in Kenya, things have been bad. Our economy is not doing well. Our are not doing well. So all factor how we feel mentally, emotionally, they are affecting us. And that's the same thing I want to say. So mental illness are those conditions that are diagnosed, which could be anxiety, bipolar, and all that. So mental health, on the other side, is a state of mental well-being, the emotional well-being that affects how we even reason or how we even act. And that's what happens, that you could have somebody who is suicidal, but they can't live a normal life, for as long as they know how to manage these conditions. But as Sam again has said, we probably are going through a lifetime, and then we go to Dr. Google and diagnose and present all the symptoms. So I'm not sleeping, I'm not eating. So this is the condition. And then they go and prescribe themselves. You start doing prescription medicines, which can actually trigger those.
Mary is having a problem with connection, but we're going to bear with her. I'm sure she's going to get back. Sam, why can't I hear you?
Oh,
you mute yourself.
I'm sure you can hear me now. All right. Let me keep going, and when Mary comes, I will yield to her.
Yeah, Sam, as you guys are talking, we are focusing on suicide today. Is it a series of things that lead, like depression? Is it a series? How long, like, what is the time frame by the time somebody gets suicidal?
That's a good question. it really it depends from person to person. I'll give you an example. If your child today, for those who have lived in Kenya, if your child scored a D minus while everybody else had a C plus and above, and you tell them, hey, you're the most stupid kid I know, this is just unacceptable in this family, this child can turn on and go to the other room and feel so sad and then find a rope and attempt something. Or if you
So
force
naturally, depression is likely to kick in first before the suicidal thoughts come in. Mary, that's where we were picking in, and then you can come back.
Yes, for most people, yes.
Yeah.
All right, Mary, back to you. Keep going. You were in the middle of a good point.
Thank you. But then, can you guys hear me? But then again,
Oh, this
yeah.
network.
So just talking about, why we need to do. Can you hear me?
Yes, you're good
Am
now.
I back?
Yeah, you're back.
Yeah, that's what I was saying. It's important for us to use the right procedure to diagnose mental illness, and to also get to a place of saying, I am actually struggling with something mentally, or my emotions are not doing well. We don't do the Google doctor, because at times we do the Google doctor and we make things worse. We actually even trigger depression because of the Google doctor, because when you start taking the
even Mary, just to interject you there, or even talking to the wrong person who does not understand
exactly
that you are not
exactly
well.
Yeah, very true. Because any small thing, just like Sam was trying to explain, even how we even talk to our children, how we even talk to our colleagues, these things can cause somebody to be in a low emotions. Like, you're feeling anxious, it doesn't mean that I need medications to come out of this state of anxiety. But then at times you just go and describe everything you're feeling, and somebody says you need to get this medication. The moment you indulge yourself in it, things get haywire. Yeah.
So the next point we were going to go to, who is mostly affected, Mary? I don't know if that's you or Sam who can respond to that.
So the who in terms of age, or the who in terms of gender?
You can do age and you can do gender, actually, because from the numbers, I'm not in you guys' field. I'm told more men commit suicide than women, because women do talk and men don't talk.
I'll jump in after Mary. I'll tell
Go
you.
ahead, yeah.
Okay, go ahead, Mary.
Okay, as I do that, Penny, allow me to say, or to ask you not to say commit, because you see, of course, suicide is, as it stands, suicide is a criminal offense in Kenya. So people use the word commit, which is a stigma in itself. So we use died by suicide, took their own lives. For that. Yeah, so let's use the word died by suicide.
Let me ask you, I thought about that before you continue. When you say suicide is a crime, there's a country that I read that if somebody in your family committed suicide, you paid the government. Is that the case in Kenya? When you say it's a crime, what do you mean it's a crime? Because you've taken your life, so who are they punishing?
We are waiting for her to come.
It's not that you pay the government. So in Kenya, they punish those who attempt.
Or if you didn't die.
Yeah, if you didn't die, if you attempted suicide and you're caught, you can go in up to 2 years.
Okay, there's a country that if you kill yourself, if you take your life, your family has to pay the government X amount. So, okay, I wanted you to clarify that. If you don't succeed, you're likely to fail. You're likely to go to jail for 2 years. Okay. So continue.
Yeah.
Oh, Mary is breaking again. Sam, you want to pick on that? We were talking about gender and who is affected.
Okay, yeah. So let me answer your question first, and then I will give you the rundown on who is affected. So here in the United States, you are not free to commit suicide either, like it is in Kenya. So if you attempt, let's say if you take a number of pills and we find you, you lose some of your rights. You will be treated by force. You will be It's called involuntary commitment. We will take you in and we will treat you, and someone will likely follow you for so long until you are not a danger to yourself.
Oh, okay.
It's pretty much the same thing that happens in Kenya. So
Okay.
when I was saying earlier that we have an ethical and legal responsibility to protect you, even if it means protecting you from yourself, that's what I meant.
Okay.
And Mary touched on something really important. When you want to go and do prescription drugs without someone monitoring you, especially antidepressants, I'll tell you right now, those in the first 2 weeks that you are using them, they are likely to increase your suicidal ideations. So if you don't know that and you already went and got the medication, nobody is monitoring you, nobody told you that, we might lose you at that point. So don't do that. Make sure that you always get diagnosed by a qualified person, and before you get those medications, they have a way they work in the body. So you need to be told before you actually take them.
So Mary was talking on the gender and the age who are mostly affected.
Oh yeah, let me go to that and then I'll later continue. So people who are married, people who have something they are looking forward to, are less likely to kill themselves. And people who are single here in the United States, if you are a single man, single white man around 30 years to 40 years, they are the highest category of those who kill themselves. Because when you are single, you are not answerable to anyone else. You are not hoping to see. You are not looking forward to see some family member you love. You It just makes that category way at a higher risk of suicide. And then, of course, I want to say even the older people, by the way, who are over 60 and are single, they're still at a significant risk of committing suicide. All right, back to you, Mary.
Gender.
Yeah, the men are likely to complete it. Men attempt less, but they are very daring. They are daredevils. When a man decides he's gonna kill himself, he will think it through and work the plan, and they usually complete more. They try less, but they complete. Women try way more, but the pain becomes too much. They just
they chicken out.
they get help, and I guess you can say chicken out. But men, when a man decides he's going to commit suicide, it's usually a gone case. All right, back to you,
Mary.
Well, yeah, I agree with some sentiments about the age. The below 40s are actually dying more of suicide lately. And yeah, because one of the things we want is suicide about life or about death? It's about life. It's not about death. So it's about life, then somebody is going to look at it from a place of, what do I have? What am I living for? So if they don't have anything they're living for, then it's easy for them to actually go. And that's the same when you use that theory, then the women become winners in this sense that they have so much to live for than men actually do. The women are naturals by nature. So the men, some, and so that because of the natural state of the women and the caring state of them, even when they get to that place of pain, they call out for help. Then the men are, this is it. Again, you want to understand what is it that actually push men to death. It's the ego.
It's the ego. Yeah.
To some, this is an achievement as well. Like, for example, when you think about a man who's lost a relationship, as a man, you're the head of the home. You are supposed to put your family together. You're supposed to put things together. So you're losing them. So you get to a place of maybe just one more thing that will make me be a champion. So because you still want to be in charge, the moment you actually take on your life, you feel like you've achieved. So the ego bit of it, but men have been told you have to be in charge. And that's why men, when you think about why do men actually die by suicide, it's because of some of these things: loss of relationships, loss of jobs. They can no longer provide for their families. They can no longer, like the last man who died, the teacher from the teacher from this particular school where a niece of mine was actually there, this one who died or killed himself because he was unwell. He had cancer, and I think he also struggled with diabetes, according to his suicide note. Like, I'm losing it. How am I going to not be in charge? How am I going to allow someone to take care of me, yet I'm the one who's supposed to take care? So that's the thing about even how we bring up our boy child. What do we show them? What do we tell them about masculinity? What do we tell them about the ego? So that's how, if we use the theory about masculinity and ego, then the women actually, the men are more in dying, but the women attempt more suicide. Sorry, but the women attempt less, more, but they don't die more.
Mary, my next question to you is, you're on the ground, Sam and I, and here we have facilities, we have things, the state has things in place to get help. The system is already built. In your practice, what is the biggest challenge that you face with now that, you know, we are creating this awareness? When you're in Kenya, when you're looking at the people that you talk to, what is the biggest challenge that people are not seeking help, or people are not aware that mental illness is actually a disease like any other disease? What is the challenge?
The stigma associated with it. The stigma is one, because do I want to speak out that I'm actually struggling with suicide? Do I want to tell people that I am thinking of killing myself as a family man? Do I want to do that? We know the men in Gusii, and you know, being one of them, you know how they take pride.
Yeah,
you know?
pride. Yeah.
Do they want to go and say, I am struggling? So the stigma associated with it, the taboos. Again, we also do not have good facilities that people can actually walk in and say, hey, I am struggling in suicide, I need help. We don't have so many of those. We actually don't even have, because when we go in, we're probably going to, it's a crime, it's a criminal. So chances are, if I say that I'm struggling with suicide and I walk into a facility, the next thing they do is call a police. We do not also have trained personnel. So somebody walks into even a normal hospital and say, hey, I am struggling with suicide. Most likely the nurses don't know what they'll do with them. The medical officers don't know what they'll do with them, you know. So there are less people who are trained to actually deal with people who are in this crisis of suicide, who are in this crisis of even mental illness. And we only think of medication. We only think of giving them that injection and confining them in a facility.
Yes, and that brings me to my next question. Sorry, I'm interrupting you because we are trying to move fast with the time. That brings me to my my next question, which is prevention. You know, we always say prevention is better than cure. Earlier on, we spoke about medication. That's why I'm bringing that in, because most of us, when we have a headache, instead of maybe trying to relax and drink water and just instead of trying to treat the headache, we get maramoja, we want to fix the headache right away, or we want to take care of that problem right away. So there's a lot of contributing factors. If you can touch on that, and then we want a quick fix. It could be the diet. You said you're not big on medication. So I wanted you to touch on some of the contributing factors, you know, or how you can try to get to your self-healing or self-care or self-awareness before you actually swallow that pill. Because like Sam said, once you also swallow the pill has side effects. Mary froze on us. Go ahead, Sam.
Okay, while we wait for Mary, let me answer something you asked earlier real quick, and then I'll get to that. One of the things that we struggle with in Gusii land is that as soon as I let you know that I'm not doing well, you people start talking about me. We don't do well with that. People cannot trust you with their issues because immediately you start saying, that is part of our culture, which is not helping with when it comes to mental illness. So people are not able to go out there and confide in us. And sometimes it's also part of our culture that we used to beat people who behaved like that or who had issues like that. We beat them into sanity. and then they just follow along. That's what we used to do. So there's a lack of mental health there completely. So when it comes to prevention, here's what I think about it. Good planning, knowing your limits, knowing the challenges that are coming and planning well. You know you're a parent, your child is in grade 8, you know next year they're going to go to high school and you're going to need the fees. So if you plan on these things early and know what your limits are, I think it creates a conducive environment where you have mental health. And then also having that support system, we also need to hold each other's hand and support each other. If within your family you know who is struggling and who is doing well, if you within the family arrange so that the resources are used well, so that all the family members are covered, guess what? You are provided a conducive environment where someone is not going to have that extreme mental pain that Mary talked about. Mary, back to you. How can we prevent this?
I think we need to look at so many things, including a system. So actually, when you think about why people are even hurting themselves now, is it because of the present or because of a past that is now bringing itself to light at the moment? That's the thing. That's what we need to look at. So even when somebody is struggling, when they sit down on their own, they actually start doing a 1+1 about their lives, and then they pick and say, wait, have I really, what have I been doing in life? Why haven't I achieved? So you realize that most of these things are from past, historical traumas, intergenerational traumas, attachment traumas, childhood experiences. So they're to light.
Yeah, Mary is breaking again.
Mary, we are losing you again. Okay.
Wait, I've been struggling. All this along, I've been like this. So you decide, I can't handle this anymore, So I think we need to look at where are we coming from. Our systems need to improve. As Sam is talking about, we need to create a conducive environment where we are all accepted the way we are. If I'm walking into a facility and I am struggling mentally, I am struggling emotionally, somebody should not jump in and judge me because asking me questions like, how many, do you do alcohol? Where are you coming from? It is, how can we help you? Not judge me because I've presented myself that I'm struggling in one way or another. Again, as a country, we are so much into crisis. We don't work into prevention. And that's the other thing. When somebody dies by suicide, focus on the person that has died, and we forget about the people that have been left behind. We focus less on the people that have been affected. And we know when one person dies of suicide, at least 115 others are affected. So if we don't help this other circle, chances are that even this one will actually end up taking their own lives or hurting themselves. So how do we also cater for these other people that have been left behind? And that's the aftercare. That's the post-prevention that we provide even as an organization. We want to take care of these people that have been left behind. How do we show them that, hey, you can actually make it. You can heal from the loss of a loved one. You can heal from the loss from working or helping somebody who is in your family who's attempted suicide. That's what we need to do. Not only focus on this person. It's unfortunate that we lose this person, but how do we take care of this? And, as a government, improve our systems. Like, yeah, we're hoping things will be better in the next couple of months or days or weeks, I don't know. When things stabilize, then people's health will also stabilize. But as it is now, we just need to help people as we work in our own families. How do we talk to our children? How do we bring up our teenagers? What do we communicate to them about? What do we communicate so that I'm struggling in this? And tell them, hey, this is how you ask for help when things are bad. So that's the other thing, even as a family, the conversations we have in our own families, in different churches that we attend. What's the message that we pass across in our schools as teachers? What do we communicate? so and so insulted me. What message do we pass to these children, or do we dismiss them off? Because if we dismiss them off, then what are we actually bringing? We could also be telling.
Oh, this network. Sam.
Yeah. Let me add something there real quick. There's a secondary level of prevention there. If we know what the root cause of your struggles are and we address that, we will actually prevent you eventually wanting to commit suicide. For example, if we know that you have been a victim of abuse, for example, we can provide you with counseling, which does not involve medications, which is equally effective actually. If we can provide this and you start feeling better about yourself, we can then prevent you attempting to kill yourself. If your self-esteem is down, if we send you to counseling and you are able to get your self-esteem back up, then you will not be able to start thinking about committing suicide. So if we do know what the actual cause of your mental anguish is, and we address it early, it can prevent you from attempting later on. Go ahead, Mary. We lost you. We need to do something about your network. I don't know what, but something.
I don't know. I think it's a Sunday. Everybody is streaming to watch football. Maybe that's the reason. So yeah. So as I was saying, it is we are hoping for better days, even as a society. Because as I said, it's not a personal thing even to those people who hurt themselves. So it's a communal thing. It's a system thing. So how do we make it better for all of us? So that's why, and of course I talked about providing care to those who've been left behind, providing care to those who are, who have someone in their family that has attempted suicide, who are having thoughts of suicide, improving care or healthcare in our hospitals, having trained medical officers and nurses. They need to know, how do we take care of somebody who walks in and says, just like when you walk into hospital and say, I have been having a headache for the last 3 days. I have not been sleeping. They know what they do. How can we empower now these same people to know what to do with those people who walk in and say, I actually feel like I want to take my life. How do we train these people to get into that space? Thank you so much, Sam.
Sam, you guys can't see. There's one question I'd like you guys to respond before we go to. There are people who want Mary's contact, and we also want to talk about what you do, Mary, on the ground, because we are actually focusing on the people on the ground. This person is asking, if you notice someone needs help and they have suicidal thoughts and you are seeing, but when you ask them to seek help, they say no. What can you do?
That's a good question. If you don't want to get help, and we know that you have attempted or you're planning to attempt suicide, then an intervention has to come in so that we can prevent you from yourself, at least here in the United States. If, for example, let me not say at that point we can intervene. You do have to do something and then we can intervene now using that as the reason for us to intervene. For example, you can want to commit suicide here in the United States and nothing happens, but the moment you take the pills, even if they don't kill you, that's enough a reason for them to bring you in so that we can commit you and treat you for so long until we feel that you are safe before we can release you, and probably follow you for so long until you are able to be not a danger anymore. But in Kenya, I guess you can end up actually dying if you refuse to get care, because not only are we limited in terms of resources there, but we are also limited in terms of the professionals available. I want, when Mary she comes back, we do have a number that you can call when you feel suicidal in Kenya, and we intended to share that.
Not even that, Sam. I wanted you and Mary to talk about what now you guys are doing, because I think we are actually running out of time. So what?
You want me to start?
Oh, she's there. Okay. She's on the ground. Yeah, people on my side, there are people who are asking for Mary's contact. And at the same time, both of you run, or she dropped again. You run a non-profit organization. If you guys can expand on that, and if there is a number to be given for people to reach out. And is there a fee? Is it free? Give all that information.
Okay, so we do have an NGO we run in Kenya. It's called CSRI. I'm a board member, and Mary is the CEO of that NGO. It's just focused on suicide prevention. That's the only thing we do. So we will share the number. If you feel like you want to hurt yourself, you will call the number and we'll direct you to where to get resources. Now, most people have insurance that will cover for their services. Some will pay out of pocket, and those who are not able to pay completely, I think additional assistance can then be planned, but it's a case-by-case basis.
Okay.
Yes. We will share that number. I actually have it.
Put it on the chat for me so I can pin it, Sam.
Oh, yeah. Okay, I'll do that.
You can put the name of the non-profit organization.
Yes, I will.
And the contact number.
Yes.
And people can reach out to Mary. Mary's on the ground. Actually, I'm sure you have a network. Once somebody calls that number, they're able to get help.
Yeah, we are able to bring resources, and yes, we want to extend this to GMA so that those people who need that kind of help, they'll be able to get it.
So, good people, the time. I think Mary is not able to come on.
Okay, go ahead.
I don't see. We just wanted to do this as an intro. This is our first time talking about this. And as you guys can see, we were literally here and there. We just wanted to introduce ourselves. It is something that we want to do on a regular basis. If we can make this chat max 30 minutes, so that way we don't take too much of people's times. But if we are consistent, we are able to cover one area at a time. And at the same time, I try to prompt people to give us questions before we can come to the show. But I'm glad that Sam and Mary volunteered their time to come and talk about this. And I'm also happy to know that they already have an existing or functional program that you guys can tap into while we are trying to get ourselves together. And Sam, I don't know if you have anything to say before we end this broadcast, because we are at 45 minutes into it.
Yes, I just want to say thank you for taking the time, those who have listened to us today. It's there's nothing that makes me feel better if we can make a difference, if you can save one life that we were about to lose. That is my main purpose here on earth. That's why I do what I do, so that we can save lives. And that is the focus of what the GMA is doing. That's what the focus of CSRI is. Please make a difference. Let people know the resources we have, and we will be there to help when we can. Thank you.
Sam, I was waiting for the information so I can pin it before I end the broadcast.
Oh, here, I'm about to send it. Just a second.
So on behalf of all the GMA group members, in fact, as I said, I want to recognize Tabi. Tabi is in Dubai. She's the one that really, as much as I was thinking about mental illness awareness in Gusii, she's like, we need to do something. And Tabi, thank you so much. And I want to thank everyone who has taken their time to come together so we can create this awareness. And we are not perfect people. Sometimes even some of us who are trying to give back, we're also struggling with something. And they always say, if you're not affected, you are infected. Did you send it? You sent it to me?
Yes, I did.
Where did you send it?
I just sent it on the forum, or I could do it in the private chat as well.
No, even you send it directly to me, then I can cut and paste and pin it.
Okay.
Yeah. So if you're not affected, you are infected, and self-awareness is like everything. Sometimes some of us are in a situation and we are not even aware that we're in that situation. In healthcare, we always recommend for people to do the check, call, and care. The check, call, and care is what's going to save your life. So even not just you, check yourself, check others. Okay, if you need help, reach out to the professionals, reach out to someone. Even the community inclusion, living in isolation is another issue. So once you've checked yourself, you know that, what, I need to go have a coffee with Sam. I need to just step out, get in the community. And when we talk about the calling, go to your primary doctor, check your blood work, involve a dietitian, look at what you're eating, look at what you're feeding yourself. Social media has created this havoc that is giving people anxiety. You could get anxiety. The next thing you know, you're getting a heartbeat. Nobody liked your videos. Nobody's commenting. Somebody said social media has put people into depression because you put something out there and it's not even, nobody cares about it. So once you do that check, once you do that call, make sure you're caring for yourself. You sent it to me?
Yes, I just did.
Okay. Once you've done all that, take care of yourself. Take care of yourself. And there's nobody who knows how you feel on the inside. On the outside, we can project, we are looking good. For this show, I had to dress up. I put my earrings. On the outside, Sam, you went and put on your nice shirt. You prepared, right? You groomed yourself. On the outside, we are looking great. What is most important is how you feel on the inside. Because sometimes this mental illness creeps in on you. It's not, you just feel tired. You're not happy, nothing. You just don't feel okay. So you might look okay, but you're not okay. So look for treatment. If you need treatment, reach out. We've given the number. Go for treatment. Some of us, even here in America, Sam, you can attest to this. We have health insurance. We've never tapped into a therapist. We have health insurance. We've never tapped into even primary care to just get checked, to even go to the dentist. And we pay for insurance. We are so busy working, doubles. You don't have time. You don't want to take a day off to go get a physical. So seek treatment. Then the other thing is, look around you, look at your family. Sometimes these things, like they say, it could be something that your grandfather, your grandmother, the doctors ask you about your history. Look at your history and look at yourself. Don't just assume that you are okay. And then look at your environment. In America, we work too hard. We are working 2-3 jobs. We are under pressure. Like Sam, you said that the ego for the men, they're the providers. They want to work 2-3 jobs. Even when they have a constant headache, they don't want to go get checked. So set time for you to go get checked. In America, the stress is too much because there's too much work. In Kenya, there is no work. There's too much stress, there's no work. You see, the environment is going to affect you. Your social support. I'm a strong believer of your friends. I can call you now, Sam. I know if I have something going on here, I can call you and say, hey, Sam, I have such and such a concern. Your network is your network. So plug those relationships in. So when you're in need, you know who to go to. Look at those things around you that are affecting you. Let me pin this number. Give me 1 minute. So that way people can reach Mary. Check on your friends. Don't just reach out to people when you're looking for help or for Harambe. you want help. That's when I'm looking for Sam. Check on Sam every now and then. Check on your friends. Check on each other. Don't just live without checking on each other, because Sam, and you can say as a professional, human relationships is everything. If you don't have a good relationship with people, when you're in crisis, you feel embarrassed. And before you know it, you're carrying the whole burden by yourself. But a problem shared, the African says, a problem shared is a problem solved. So I've pinned that. You guys can reach Mary. Mary is the CEO, Center for Suicidal Research and Intervention. And the phone number is 0703 38 8130. I have pinned it there. All right, Sam. We did amazing. Thank you so much. Time is money, for taking time from your busy schedule. Thank you, Mary. I know you dropped off, but we are going to be coming back here on a regular basis to continue the discussion. And Sam, the other thing I wanted to touch about was volunteer work. You know, in the early days, the Americans and the Europeans came to do volunteer work in Africa. And if you look now in Africa, you know, it faded away. The one thing that I have tried hard, I don't know how we can get our people to get this, is what you're doing now, Sam. A lot of our people, let's say in America, they are in the healthcare field. A lot, the majority, slightly over 50% Africans are in healthcare. But we are not able to gather ourselves. And I say this because we are getting ready for the Mental Awareness Month in Kenya. We are not able to gather ourselves as a team. Even bring the resources, even if you're not going to be there, to do the volunteer work where we are not getting paid. We are not running a non-profit organization because we want to ask for a position in our local home. A lot of people in America that run the non-profit organizations have intention. They are planning to run for office. And that's the most painful thing that I see from us, especially the Kenyans that I know here. They are running these non-profit organizations in preparation to run for office. Their support to their local communities is tied to something. They're looking for something. And when you're giving help, looking for something, if you don't get it, what happens? You pull yourself out. If we can get to a place where we are passionate about giving back, where I'm going to say, Sam, in end of May, me and you are going to get in flight to go back to Kenya. The reason for our trip will not be to go see your relatives. It will not be to go to Mombasa, to go to eat life, nightlife. Our goal to leave America, that's what I'm looking as a visionary for this organization, for GMA. I'm looking forward to the day that a lot of us will get in flight, not to go see anybody, not to go on vacation, but to go home as a team, the way Americans have been doing for us, on the ground, and say, Tabi is going to say I'm from Dubai, Lina is going to say I'm from Minnesota, you're going to say you're from Texas. We go on the ground and create mental awareness and give our time to our people. And if we look back in America, the people we call celebrities, the highly successful people in America, even the highly successful people from universities. I was giving an example of Allegheny, where our high esteemed Sagini went to, where my son is going to college. The CEO for PNC went to Allegheny. He gives most of his money to that university. His earned income. His money goes to that university for some of the children that cannot afford to go to school. If the Africans, if we can get ourselves to that situation where we are taking our resources, not just to send money to our families and buy so many plots, We take our resources. After you've gone to school some, you become a professional, you're earning, you're going to take your money, getting a flight, and go give back to where you came from without expecting anything back. That is my prayer this morning. I missed church to do this service, and as I'm punching out, I'm saying that is my prayer, that we can all give without expecting anything back. And we don't always have to give our brothers and sisters. We can give the less fortunate, the way these basketball players, football players, these Americans give back to where they came from. Because you know what? If you forget where you came from, you will never know where you're going. You have to look back. With that said, have a beautiful Sunday, and thank you guys for tuning in. Sam, cheers. Have a nice one. Thank you so much. All right. That's it, folks. Thank you so much for tuning in. It is not easy to stop everything you're doing and give yourself to volunteer work. It's not an easy thing to do. It doesn't just come. You have to set a time to give back. And this is what you're trying to do. It takes a lot to stop everything you're doing to give people your time. It's not as easy as people think, but we the Africans, I'm addressing we the Africans, we need to get where the Americans got, where you're just okay with the little that you have that you can give somebody else. We are acquiring so much. We own so much. We want to own we want the ego. We want people to know we own this and that. And we cannot change our communities where we came from. It takes sacrifice. I've had this dress for a little over 5 or 6 years. The quality is still good. How many dresses can you buy? How many clothes can you buy? We can get to a point where we can give back without expecting anything. And that's the challenge. I come on Facebook to talk every day because I'm passionate about what I'm doing. I just want to inspire one person if I can. If you look at me and I encourage you and make your day a better day, that is mental illness awareness creating. Yeah, that is when I tell you that, oh, my day is bad, your day can be better. I used to have bad days, my days are good. If I can come and tell you I'm a success story, I hope where you are, you can eventually come out and be where I am. And I am where I am because I'm working on myself, self-care, self-development. I hope we've inspired you. I hope we've encouraged you today. And I hope you learned something from this show. And above all, do community inclusion. Do not live in isolation. Friends are everything. The people you surround yourself with are everything. Social media friends are real, but they're not real. Find local friends where you can go have coffee. Find local friends where you can go eat a meal, where you can go take a walk together, where you can go to the fitness center together. Be a part of your community. Have a beautiful Sunday. And remember, in your struggles, you're not alone. We are just a phone call away. We are text away. I have the network. If you need any help, reach out to me. We'll get you the help that you need. God bless you.